Hello everyone and welcome back to MediNotes or Medicos. The topic that we're going to deal today is eye infections from microbiology. We'll be going through the introduction, the extraocular infections, intraocular infections, the complications of eye infections, lab diagnosis and the treatment. So the common eye infections that we deal in our day-to-day life as a clinician would be conjunctivitis, corneal ulceration, endophthalmitis. And the classification of eyes is based on either extraocular or intraocular infections. Now, extraocular infections means it involves the external parts of the eye. Now, what are the external parts of the eye? It's corneal adnexia, which involves the structures like eyelid, cornea, conjunctiva. And intraocular means it involves the internal structures of the eye. So, the common extraocular infections are first is stye. The commonest organism that causes stye is Staphylococcus aureus, and the pathogenesis of this organism is that this bacteria, it infects the oil gland present in the eyelid or the eyelashes, causing the formation of stye. If you see this picture over here, this is a formation of stye. It presents itself as a red painful bump under the eyelid or at the base of the eyelashes. You can see over here, this is the stye formation. Next is conjunctivitis. Now conjunctivitis can either be caused by bacteria, viral, fungi, parasites. Okay. Now bacteria, commonly it's caused by chlamydia, staphylococcus, pseudomonas, neisseria, gonorrhea. In viruses, we can see it is caused by enterovirus 70, that is also known as EV70, Coxsackie A24 and adenovirus. When we go for fungi, it can be caused by Aspergillus, Fusarium or Penicillium. And in parasites, it can be caused by Acanthamoeba, Toxoplasma gondii, Tania solium and many more, etc. And the clinical presentation is the eye appears as congested. If you can see over here, the eye appears as congested. It appears as pink or reddish with watering. You can see the watering over here present. It appears as pink or reddish in color, and it has persistent itching, eye pain, pricking sensation or gritting sensation. Why? Because you would find some things like this under the eyelid which gives a gritting like sensation, like if you have touched the sandpaper, you can find a sort of sensation. So that sort of sensation would be felt under the eye. It gets sensitivity towards the light. There is watery eyes, chronic redness, discomfort, and there is discharge of fluids, blurring of vision occurs, and swelling and dryness can be seen. Next we'll be seeing about Loasias. Its causative agent is Loa loa. Often it is known as African eyeworm. So this clinical presentation occurs or develops due to the subconjunctival migration of the adult worms. If you can see over here, you can clearly see an eyeworm over here. Next is keratitis. So keratitis, the causative agent can be bacteria, virus, parasites, fungi again. Okay. Now in bacteria, it can be caused by Pseudomonas, Staphylococcus. In virus, it can be caused by herpes simplex, zoster, and acanthamoeba and Naegleria parasites. And for fungi, it can be caused by Fusarium, Aspergillus, and Penicillium. So this is how a keratitis eye looks like. This is basically after fluorescent dyeing has been done in the eyes. It is actually an inflammation of the cornea and common in the people who uses contact lenses. Next is uveitis. Uveitis can be caused by virus, that is by herpes, and it can also be caused by autoimmune disorders like rheumatoid arthritis and or lupus. This is the inflammation of the middle layer of the eye, that is the uvea. So this is somewhat how a uveitis eye would be seen as. Next we'll be learning about blepharitis. Remember, we are going through extraocular infections. We have not gone yet to the intraocular infections. So blepharitis is an inflammation of the base of the eye. You can see over here, it is a dandruff like thing like you see in the head. This is seen in the eyelashes over here, beneath the eyelashes over here. So the inflammation is at the base of the eyelashes and it is caused by the bacteria. Most common is Staphylococcus aureus. Then we have trachoma. Trachoma causative organism is Chlamydia trachomatis, and it is also known as the chronic keratoconjunctivitis of the eyelashes. This is a clinical presentation of a trachoma. Next is ophthalmia neonatrum. Ophthalmia neonatrum, by the name neonatrum itself, it indicates that it happens in infants or the neonates. It is basically conjunctival inflammation occurring during the first month of the life of a baby. The causative agents is chlamydia and gonorrhea, herpes simplex. It occurs as severe purulent conjunctivitis, and it might lead to corneal ulceration. So basically a clinical presentation like this seen in a baby is known as ophthalmia neonatrum. Next, we'll be looking into the common intraocular infections. So before that, we'll be looking into the pathogenesis. So how does this intraocular infection occur? So the entry of the pathogens would be via the bloodstream, the nerve root, contaminated eye drops, contact lenses, or it can be due to trauma. Now we will be going into the two most common intraocular infections. The first is endophthalmitis. Basically, it is caused by in two ways. One is exogenous and the other is endogenous. In exogenous, it occurs if there is any penetrating injury to the eye. However, in endogenous, it can be caused by panophthalmitis or complications of a bloodstream infection. And almost any organism can cause endophthalmitis. Next is chorioretinitis. It is caused, basically common etiological agents are cytomegalovirus, Toxoplasma gondii, and Toxocara canis. We'll be dealing with complications of eye infection. The first one is orbital cellulitis. The given picture over here is known as orbital cellulitis. It is basically seen in children, and it is the infection of tissues that surrounds the eyeball. Okay, it's an infection of the tissue surrounding the eyeball. Next is dacrocystitis. Dacrocystitis is the swelling and blockage of the eye tear drainage system. That is, this is known as dacrocystitis. This is how a clinical presentation of dacrocystitis would be looking as. Next is corneal ulcer. Corneal ulcer, the causative agent would be adenovirus or enterovirus in viruses, toxoplasma or microsporidea in parasites. So this is how a corneal ulcer presentation would be seen as. Next, we'll be learning about the lab diagnosis. So for the lab diagnosis, the specimen that we would be collecting is either eye discharge or swabs or aspirates or worms. In case of worms, we would be detecting the microfilariae or other worms lodged in the eye or which is migrating across the eye. And we will be taking a bedside smear, and we would be doing inoculation on culture media. And in culture, we yield the causative bacterial agent. Now the treatment is topical antibiotics, that is ciprofloxacin, azithromycin, vancomycin drops. For endophthalmitis and other ocular infections, we can give them topical antibiotics as well as systemic therapies based on the disease or infection it is. Then for worm infection, firstly we would give the surgical removal of worms. Then we will go for primary infection treatment. Next is herpes infection. For that, we can either give only acyclovir or we can add topical therapy along with acyclovir. So this was the video for today. Actually, this is just a brief. We will be learning in more details in ophthalmology in the third year subjects. So this was for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to our channel. We'll be coming with more videos. Till then, stay tuned. Happy learning. This is Ashna Viraj signing off for today. Bye.